Former economic advisors Robert Wolf and Steve Moore recently discussed the potential effects of President Donald Trump's tariffs on the healthcare industry, particularly how they might impact costs for consumers. While there are concerns, experts suggest that the tariffs may not lead to the catastrophic consequences that some anticipate. According to a survey by Black Book Research, 84% of healthcare consumers believe that Trump's tariffs will drive up costs for medical treatments and drugs. However, Chris Pope, a health policy expert, emphasized that healthcare is not a heavily trade-dependent sector. He explained that services like physician visits and hospital care are provided domestically, representing a large portion of healthcare spending. When you remove these elements, you're left with the portion of healthcare that is affected by trade, drugs and medical devices, Pope noted, which comprise about a quarter of total healthcare spending. Christine McDaniel, a senior economist at George Mason University's Mercatus Institute, echoed Pope's sentiment, acknowledging that while the tariffs could affect the industry, the impact is unlikely to be disastrous. It's not completely devastating, but it's definitely annoying, McDaniel said, adding that industries may absorb the costs or pass them on to consumers in various ways. The potential effect of tariffs on drug prices is particularly concerning, given the U.S.'s reliance on China for key ingredients used in medication production. Pope pointed out that the tariffs would likely impact generic drugs more than branded ones. Generic drugs, which are already relatively inexpensive, typically cost under $10. However, Monica de Bolle, a senior fellow at the Peterson Institute for International Economics, painted a more alarming picture, suggesting that the tariffs could raise prices on a wide range of medications. Everything from over-the-counter drugs like Motrin, ibuprofen, and Tylenol to psychiatric medications such as antidepressants will be affected, she said. While drug costs could rise, experts agree that the impact on medical devices is less straightforward. McDaniel explained that tariff-related disruptions in the supply chain could drive up costs by complicating the manufacturing process. For example, additional stages in production or sourcing components from more expensive countries could raise costs. Pope added that the overall effect will vary depending on where devices are made and where their components come from. The issue of reducing dependency on Chinese-made medical products, especially for critical drugs like antibiotics, has been a topic of discussion for some time, both among lawmakers and within the healthcare industry. This ongoing conversation about potential risks tied to China's control over the supply chain has gained additional urgency due to geopolitical tensions. Discussions about moving drug production out of China were happening before Trump's tariffs, and they continue today, de Bolle noted. While Trump's tariffs may be new, experts stress that the broader efforts to reduce reliance on China for medical products are not. The tariffs themselves might have accelerated these discussions, but they are part of a larger trend to secure the U.S. supply chain and mitigate potential national security risks. In conclusion, while Trump's tariffs will likely lead to higher healthcare costs in some areas, particularly for drugs and medical devices dependent on Chinese imports, the effects may not be as severe as some have feared. Moreover, the drive to reduce the U.S.'s dependence on Chinese-produced healthcare goods has been ongoing, regardless of the tariffs. Thanks for watching.